start that this is a common picture, and we are all aware of this picture. And if you visit any hospital in the Delhi or in the Jodhpur or any busy city, you'll find the same picture. The hospital OPDs and the emergency is busy with the patients, and they are so much crowd is there that it is very difficult to get to the doctor's desk also. And this is showing this the tip of the iceberg. When we say the tip of the iceberg, that is only 20% of the people who are suffering are coming to these hospitals. And the rest 80% are in the community, which we are not exposed to. So when we are studying in a MBS course in any hospital, district hospital converted into medical college or a AIIMS or AIIMS, the picture is same, that is you are studying the tip of the iceberg only. You are not aware that is what is happening in the community. And now this rapid advancement in the technology, this is also proving very challenging for the students as well as everybody. The challenges of transport, challenges of moving from one place, getting the treatment at a very highest pace, with a rapid pace, surpassing the way the disease is progressing. So the disease might have taken 5 years or 6 years to develop, but they want the cure within few hours or urgently. And this is the way we are having shortcuts. We are trying to approach the problems with very shortcuts, with a rapid advance. But at the same time, the world has shrunken. And you can see that the world is at your fingertip. And you can move from one place to another place very fast. And when the India is moving on the Chandrayaan to the moon, that pace is super fast. With the Vande Bharat Express connecting many of the cities, the Jodhpur connecting to the Ahmedabad, another Vande Bharat from Jaipur to Udaipur, then to Ahmedabad. So they are all there, and they are decreasing the distance. But the most important thing which is improving our health is the communication and the ways of communication and the technology. So when we say technology, so everyone's mind goes to कि एक gadget है, microphone है, ये projector है, and this is displaying. And the next person, Dr. Anubhav Gupta, will be presenting the CTAC invented software, that is Hospital Management Information System, and you'll learn that how many things are there in the technology. The technology is also with the e-learning, which is happening these days. But the technology does not only means the devices. It also means the way you deliver the healthcare. So a simple innovations can take care of the 80% of the problems of the country, 80% of the community problems. And simple innovations can be the ORS, simple education, awareness. So if you are able to create the awareness among the masses, that is the most important contribution of the technology. It is not that the robotic surgeries or the surgeons operating in the OT, they are doing the best. It is the people who are doing in the community. And that is being recognized by Government of India now. And what they are telling is that we have completed 75 years. And now we have from 2022 to 2047 is another 25 years. These are known as Amrit Kal. And the Amrit Kal means that the way of advancement of the technology and the simple innovations, the startups, the low-cost affordable healthcare are now the prominent features during this period. It is not the high-tech technology, but it is the low-cost technology which is affordable by the masses. And that's why the government is exploring the ways how we can touch the lives of many people through the technology. And I think communication is one of that. So the government scheme, and that is also very important for the interns to know about the government schemes and how they can promote and they can utilize these schemes for the benefit of everybody. And Ayushman Bhav is one of the important scheme which has been launched this year. Although the National Health Policy, everybody knows when the National Health Policy was written. So there was a national health policy in 2083. Then it was enhanced in 2002. And recently, कब आई है national health policy? 17, yeah. So 2017 has seen another way how the technology, interdisciplinary transmissions, communications can help the healthcare delivery. And the most important, the medical education and the healthcare delivery. Till now, we are concentrating on the infrastructure development, but from 2017 onward, it is the nudge. That is the behavioral economics. Without you being aware that something is happening, the things are happening around you. And these things have been devised by the, earlier it was known as Planning Commission, now it is known as Niti Aayog. So Niti Aayog has a think tank. In the think tank, they create a lot of ideas which are gradually changing your behaviors. And you have seen that Swachh Bharat Abhiyan was started in 2014. And now 2018, they started with the Ayushman Bharat scheme. Ayushman Bharat scheme has two components. One is the insurance scheme and the second is the health and wellness centers. अभी कोई बताएगा कि what is the name of the health and wellness centers now? Jan? Arogya Mandir. So now they have come with the Arogya Mandir. And they say that this is the similar to the people seeking health in the temple. The temples are there where the pujaris are there and the people are coming there. So the medical teachers, they are just like, or the medical not only medical teachers, but doctors are like pujaris and they have to work and deliver the health. Now these Arogya Mandir are meant to be delivering the healthcare at the doorstep. So as part of this Ayushman Bharat, they are Ayushman Aapke Dwar. So Ayushman Aapke Dwar 1.0, 2.0, now 3.0. That is the healthcare can be taken to the doorstep of the patient. And once you know that 5 lakhs of that free insurance scheme is already there for those who are unorganized sector, not everybody. And then everybody should have the Jan Arogya Yojana, which is providing the free medications for some of the disorders. Rare disease policy, which are providing the health to the people with the rare disorders. And then Ayushman Bharat Health Account ID. How many of you have your health Ayushman Health Account ID created? So Dr. Anubhav will also tell about these ID cards, how it can be made and how it can be accessed throughout the world. आयुष्मान सभा, अभी जो हम लोग एड्रेस कर रहे हैं ये भी एक सभा ही है. अभी तक आप देखते आए लेक्चर थिएटर बोलते थे, उसको अब सभा भी बोला जा सकता है. सभा है कि बहुत सारे लोग एक साथ बैठ के दे कैन डिस्कस अबाउट सम ऑफ द इश्यूज. एंड हियर यू कैन सी दैट द medical doctors, a team of the medical doctors are interacting with the people in different areas in the community. And this is the northeast area where they are training about how to keep themselves safe. Then Gram Panchayat or Ayushman urban wards. Now these are the upgraded Gram Panchayat where the people have attained at least 100% of the targets. So the targets of Ayushman cards, screening for the non-communicable disease. Now, all these things are important for the intern to know as a part of the communication skill. So, interns are the most important source of health information. And if they are not aware, how they can spread. That's why it is very important for the interns to be aware of all the schemes of the government, as well as all the schemes which you have learned in the CMFM department. So, there are multiple of schemes which are there. And the government is now trying to use the technology to converge them, integrate them, so that there is no isolation of the schemes. One scheme does not lead to the suffering of the other schemes. So all these things are interrelated. So these are some of the targets. So in the Gram Panchayat leaders, these sarpanch, they are telling the people about the various schemes. So that is what is known as community engagement and involvement. Unless until the community is also engaged and involved in their own care, the health will not improve and we will concentrate only on 20% of this ivory tower. AIIMS Jodhpur is an ivory tower. It is there. We are safe here. We are we are feel very safe that we are working in this area. And whenever we are exposed to other outside situations, we feel not confident enough to handle those situations. So that's why it is very important. That is, we are not only work in this 20% of the problems, but also 80% of the community health problems. So there is implementation challenge. How the technology can be integrated and whatever is available at our end, which should be used. With the drone facilities being launched in the country, and the drone didis are being prepared. You know, drone didis. So these are the things which a medical student should know. Drone didi are the self-help groups people who are in the villages. They will have some part-time job to deliver the medicine through the drone. So they will know how to handle the drone, how to take out the medicine, put the samples back, and then it will fly back. So these are the things which are coming and rapidly growing. So when we talk about this technology, we always concentrate on the tele part. That is the technology part. We just go and discuss with the IT people कि ये technology ये होगी ऐसा होगा, but we forget about the medicine part. As an intern, this is your job. That is, you have to concentrate more on the medicine part. Medicine means that the health should be made. Support for the health, preventive health, promotive health, curative and rehabilitative health should be provided. So that's why this tele part should be integrated with the medicine. And how we can do it? And this is one of the things which we have realized in the tribal area in Abu Road. Your senior batches in the residents are being posted there. And they are learning about how we can remove this disparity in the healthcare. So telehealth is the how we can facilitate the delivery of the health to the remotest area where the services are not available. You talk about the drone, they can be used for teleeducation, not only for drug delivery and sample processing and blood delivery, but they can also use for the education. So these are some of the glimpses how we are conducting the telehealth delivery at Abu Road. Now this Abu Road is being considered by Minister of Tribal Ministry also as one of the area where they can do much more research in this area. Research is an integral part of the communication. So unless until you do a thorough data collections, that is also a little part of your training. So as an intern, this is your responsibility that you use this technology to the utmost. And this was a program which was launched there, that is managing illness using telemedicine for travel in the remote areas. In a short acronym form is MITRA. And similarly, the MITRA program is again be used by Government of India in some other perspective also. So when we talk about the opportunities, you have a huge opportunities. But if we concentrate on the two opportunities which are very significant, which are very important, one is the pregnancy and childbirth up to 2 years. That is what is known as 1000 days of life. And the second is the teenager, Kishoravastha. That means you have to go to the schools. अगर इसको हम दो को टारगेट करते हैं तो almost 90% of the disease can be taken care of. Now the pregnancy is too late. Once the pregnancy is there, it is too late to take any action. It is 9 months will go and the baby will deliver. But there are so many. Japan is the one country in the world which has no MTP rules. They don't have any termination law. And it is illegal to terminate any pregnancy. Now, this is a law, but in effect, it is a blessing in disguise because it created the workforce who are catering to the technology preventing the disease in the uterus. In the uterus, they are treating the disease. Or also, they are also working with the teenage people to prevent the disease, first of all, in the first place, to prevent the disease in the offspring. So all these things can be done through the technology with a communication. अगर हम आपसे कम्युनिकेट कर रहे हैं तो आप लोग को कुछ डिफरेंट मैसेज मिलता है जब हम लेक्चर लेते हैं, बिकॉज वो बहुत टेक्निकल वर्ड्स होते हैं और आप जब स्कूल में जाते हैं तो आपको डिफरेंट वे में उनसे अप्रोच करना होता है, बिकॉज नॉन टेक्निकल वे में उनको कैसे अप्राइज करना, बिहेवियरल इकोनॉमिक्स के प्रिंसिपल्स को यूज करके उनके बिहेवियर को चेंज करना, इट्स नॉट ए ईजी जॉब एंड ऑल्सो इट कैनॉट बी डन इन half hour, 1 hour. It takes a long time. So I think these window of opportunities, the 1000 days of life, and this is teenage years. The teenage years are up to age of 25 years. Up to 25 years, the brain is developing. Dendrites are growing. Dendrites are interconnecting with each other. And that's why there's a huge opportunity if we encourage these dendrites. Because as an intern, you are the most important person whom we can target. After internship, during the residency, it is too late. No changes will occur. And on the first day, if you are a behavior of not participating in the department with a full enthusiasm, that means our job is not well done. And you will see that later in the life, you'll regret it that why you have changed this internship process. Internship is the most important period where you can work without any conditions. You are under supervision. You can have the mistakes, although these mistakes should not be like actively, deliberately, but they can be corrected because you are under supervision of the. You cannot write the prescription. You have to be under supervision of the faculty members or the resident. So this is our auditorium. We took the class on what are the right ways and the wrong ways, wrong decisions and the right decisions. Sometimes decision may not be apparent at that time whether they are right or they are wrong. You may be thinking at this stage, appearing for the PG entrance exam, using the coaching class is the right decision, but it may not be right decision. So school health education is one of the area where we can change the world. And if it is properly approached, the school is the best place. So these Arogya Mantir have a connection with the school. Adjoining school should be targeted without disturbing their ongoing syllabus. We can conduct some of the health promoting programs in the form of posters, in the form of presentations, in the form of some drawing competitions, all these innovative ideas, because these are you are the people who have the most innovative ideas and that can be used. Your workforce is very important for the community. So ultimately the purpose of this health communication for the medical student is to encourage the health seeking behavior. That is most important. And while you are doing all this in the background, you will learn new skills. What are the indications for operation? What is the stereotactic surgery? How we can do the epilepsy surgery? How the rapid robotic surgery is occurring? What the transplant? What are the criteria for selecting the? And everything is changing. अगर आप जो आज समझते हो, सोचते हो, पढ़ते हो, आगे 2-3 साल में चेंज हो जाएगा रैपिडली. अभी बहुत सारे ऐसे कंट्रोवर्सीज भी क्रिएट होने लगी हैं. क्या राइट था हमने फेस मास्क कोविड में लगाया? क्या राइट था? कुछ ऐसे क्या वैक्सीन हमने लगाया? क्या राइट था या रॉन्ग था? So ऐसे कुछ चीजें हैं which gradually you will learn over a period of time. Something new takes time for the result to. Education policy, national education policy in 2020 was there, but the implementation is seeing lot of challenges. It cannot be implemented. हम कहते हैं flip classroom होना चाहिए. The lecture should be abundant. Instead of the lectures, there should be 50-minute sessions. हम 2 घंटे के क्लासेस होते हैं आपका माइक्रोबायोलॉजी का, फार्माकोलॉजी का, उसको कन्वर्ट कर दें 15 मिनट्स के, हाफ आवर का क्लास हो गया. गो टू द वार्ड, गो टू द ओपीडी, डिस्कस विद द फैकल्टी मेंबर्स एंड लर्न ऑन द वॉक, लर्न ऑन द गो. ऐसा करने के लिए आपको टेक्नोलॉजी आपके पास अवेलेबल है, फैकल्टी आपके अराउंड हैं, स्टूडेंट्स आपके अराउंड है, पीयर ग्रुप आपके अराउंड है. तो यू कैन टेक ऑल दिस हेल्प. Why to go for the lectures? Why not the flipped and blended classroom? Why not to learn from the patient? Patient is a great teacher. And I think it is the true. Patient is the most important teacher. Even if the healthy person is walking down the OPD, you will learn so many things. You just sit in the OPD, you learn so many things. So I think health communication, that's why is very important to change the behavior. That is all I would like to say. Thank you.